Now, thank you, Miss Deb. If we're not able to answer questions for you, please reach out to me later and let's see if we can get some specifics to help you specifically, maybe cut through some red tape or at least find some additional resources. That would be great.
Okay, thanks.
Miss Linda, you're next. You're on. You.
Good morning, everyone. Are we doing introductions, Jim?
Yes, please.
Okay. Good morning, everyone. My name is Linda Donor, and I'm the Regional Operations Manager for the Northwest region at APD. It's very nice to see new faces.
Thank you, Miss Linda. Now, are you representing APD today, or do we have somebody from APD, the Voc Rehab, maybe?
Yes, I can answer questions and represent the APD as much as I can.
Gotcha. Thank you so much for joining us. Next in line is Miss Wendy Capperson. And Wendy, you're let's see here. Wendy, you're muted if you're online. There you go.
Hello. So I'm a area director at Pensacola Developmental Center. We're an ICF providing services here in Pensacola.
Wow. How many people do you have under your, how many clients do you have out there?
We have 58.
That's quite a lot. Do you have any availability or are you just pretty much full?
Yes, so we currently have 4 male vacancies.
Gotcha. Okay. And what are some of the criteria for someone looking to get into an ICF?
They have to elect to look at an ICF when they apply for services with APD, and they need to have acquired their intellectual disability before the age of 18.
Okay. Gotcha. So they've got to meet criteria for the waiver in order to, for that. Wonderful. All right, let's switch back to Miss I still can't pronounce her name. Unicia. I hope I got that right.
Correct.
Can you tell us about your organization and some of the things that y'all do?
Okay, so I'm with Legal Services of North Florida. So we provide free legal services. So if someone needs like an attorney to represent them, we also give out legal advice. Sometimes, you just have a legal question and you want an answer, and then you can, go ahead and do what you need to do. You might not need the attorney, maybe like filling out some legal paperwork. A lot of times with like Social Security, a lot of people, when they apply for SSI, they might have questions how to fill it out, or if they get rejected, a lot of times we will help with the appeal process. And then we also do like legal clinics. So if an organization wants like a specific topic to be addressed, for example, we partnered with Favor House and we do domestic violence workshops and clinics for them once a month at the courthouse. So we can pretty much go anywhere in the community and do, like I said, legal topics, or we can have the clients come to us for the advice or for representation. And everything, like I said, is free. It is based on income. We have a lot of grants, so it just depends. Like we have a grant that services veterans, for example, so that income criteria is different. And then the grant that I'm under, the Escambia Children's Trust, we only service children in Escambia County, and the income is different on our grant. So anyone pretty much that needs legal services, civil services, they can call our number, they can email us, they can go online and apply, or they can come in person just to find out.
And is the need, is it then staffed as far as kind of the greatest need, or what's some of the selection process that y'all look at?
So as long as it's a civil matter, so we do like, we have a flyer, I could email it to you as well, and
Nice.
kind of lists some of the cases that we do, like evictions or landlord-tenant issues, family law. So anything that's not criminal. we can assist with. So they would just have to call or like say come in person or go online and just kind of state what their issue is. And then our attorneys will decide like if this is something the organization can take on or assist with if we have an attorney that's an expert in that. If
Right.
not, we do have partners like pro bono lawyers that work with us. And then we also refer them to the Florida bar if we can't help. So either way, we can guide them somewhere if we can't do something so they could get the services that they need. And the program that I'm under, the Children's Trust Fund, that was established just this year in March. And so we work with education rights. So any
good.
child in the school, yeah, that needs help, maybe with an IEP, if they need an advocate, or right now we've talked to Escambia Westgate and guardian advocacy is one of those issues that came up. A lot of times when individuals with disabilities turn 18, they're going to need a guardian. So not always full guardianship. Sometimes they just need somebody just to be like a guardian for them. And
Right.
so we're working with the families to provide that, to assist them to do it, the whole process. We can help them fill out the forms or go to court with them if we need to, but just to make sure that those students and the families get that taken care of. And I know you can apply like when you're 17 and a half. So it
Right.
helps before they turn 18 to get that out of the way. And just doing research, it's about $5,000 if you go through a private attorney. So with our services, it's
expensive.
free. Yeah. So it helps in that way with students. So pretty much anything educational we can represent as long as they're in Escambia County through this grant. But
Gotcha.
Legal Services of North Florida covers 16 counties in Florida. So there's different grants in different counties that can assist with all of these issues or even more.
So basically that's from Pensacola to Jacksonville, maybe?
Let me pull it up, and when I send you the flyer, it's also on there.
Okay.
All of the counties, the names of them, so that way you guys, if you'd like to share that with everyone, that way you can have like the exact name of the counties.
That would be great. We'll post that to our Facebook group. And also
Perfect.
post it under the Family Care Council. To give you an example, I was trying to become a guardian advocate for my son, Ben, and went to Santa Rosa County Family Courts and to the clerk of the court who just stared at me and went, "You need to find a lawyer." But ma'am, I don't have a lawyer. Can't afford a lawyer. So we were able to track down the guardian advocate paperwork for someone in Bay County. So I went back to the same to that same office and said, "Okay, well now what happens if I have the paperwork already filled out? I put Santa Rosa County and I put all the names in it." And the best advice they could give me was, "Well, you can pay $400 filing fee, and then we'll run it by the judge to see if it's adequate enough." So I really felt like I was just being turned away, and go find yourself a lawyer. Otherwise, don't bother me. And it was kind of a sad experience with it. We're really glad to have you on today.
Yes, sir. Thank you. And that was one of the reasons when we talked to the school social workers, we were asking, what's an issue that you have seen across the board? And when they brought that up, they said the same experience as a lot of parents were just given the paperwork and be like, this is what you have to do, or here's a number to an attorney to call them. But it's not, the legal process is never easy in
Right.
any matter. So
Yeah.
that's with our services. At least you can have guidance with somebody that knows the process and can give you the right advice.
Yeah, well, they wouldn't even offer me the paperwork and go, "Can I
Oh,
buy a
my.
packet or anything?" Well, no, you need to find a lawyer.
Yeah.
So thank you so much for
Oh, yeah.
taking your time today. And um, if you'll email me that flyer at the By My Side Today, the same one we registered through, I'd
Yes.
love to post it. And
Thank
then
you.
we're moving on. Miss Center for Independent Living, Miss Carolyn, welcome.
Hi. Thank you so much for having us today.
Glad to see you're here. Now,
Yeah.
CIL's you guys have really expanded your services for people with disabilities, and I'm really impressed by seeing this stuff on Facebook and some other resources coming out. Can you give us an idea of what CIL is now doing today?
Right, so the Center for Independent Living of Northwest Florida is available to all of our community across our 4 counties, from Escambia to Walton County. And we provide services to people with all types of disabilities. So from you name the disability, we provide the service. We try to advocate, provide independent living skills, information referral, peer support, and provide services that are often forgotten about, in the sense that people with disabilities are needing different types of services at different times. And we try to make sure that we are there to provide those services. We look at trying to make sure that we can advocate, we can be reaching the different community members in different ways. And I guess it's kind of each person is unique and each service is unique. And so that service train is not necessarily the same.
Mhm.
But at the same time, trying to make sure that we provide equality to each person and looking for what might be there. So sometimes it can be as simple as an ear, and sometimes it meaning that we're listening. And other times it can be providing a piece of equipment. Sometimes it can be providing a magnifying glass. Sometimes it can be providing a set of diapers, some adult diapers. Sometimes it can be providing services from a peer support group that may be occurring each month. Sometimes it can be providing that link to our other programs that are in the community. Sometimes it can be making sure that individuals get assistance with filling out paperwork,
Mhm.
or getting access to providing connections to folks such as Annette Zeeb, who's on the call today. It could be providing access to all different kinds of things. So I don't know if individuals on the call have specific questions, but we're happy to answer any questions that we can.
Gotcha. Did you get any grant funding, or are you, there's a big push in Florida right now, of course, to get people with disabilities employment. So is that part of the services you might offer?
Right. So our services sometimes that we provide are assisting with individuals being able to go through practice for employment. So it might be interviewing skills that they might need. So Danny at our office will often do role play interviewing with individuals who are looking for employment in the community. Sometimes we will have fee-for-service programs that come to us through vocational rehabilitation or Division of Blind Services for individuals to get those services, and being able to assist people to practice those skill sets, or it could be helping to make sure that people get reasonable accommodations that are needed in order to maintain that employment that they might be successful in getting, and then making sure that a person knows what they might need to maintain that job site, and being able to look at that.
Yeah, that's a big one. Wow, you've really expanded with different things now. Do you have at one time you all had a meeting once a month? It was, I don't know, it if it was a support group or what have you for individuals who with
Mhm.
disabilities.
Yeah.
Do you still have special meetings like that?
Yes, we do. We have on usually the third Monday of the month, we have a meeting that takes place. Or actually, it happens twice a month. Let me rephrase that. It's happening. If they get in touch with us, we'll get them connected. So our phone number is 850-595-5566 or info@cilnwf.org. Either way, we'll get them connected with when that support group is taking place,
Mhm.
and make sure that they get connected to it. And then that way they can participate as individuals or family members with that group, the peer support group. And we'll make sure that they can do that. If there are individuals that are wanting additional services for peer support, then we'll make sure that they get that as well.
That's wonderful because peer-to-peer is one of the best resources sometimes people can find.
Right.
Now, do you have to be an individual with a disability to join that group, or can you be a guardian advocate or a parent of someone?
Mhm. Yeah, so you can be a peer or a guardian advocate to join that group.
Okay.
And at different times, individuals come and go from that group. We never know who's going to be joining at different times from
Mhm.
month to month. And we certainly welcome people to participate when they're needing that peer advocacy or that peer participation.
Wonderful. Thank you so much for what you do, and you've got a great organization there. We're glad
Thank
that you
you.
joined us today.
Thank you.
Part of this call is also trying to build collaboration in the Panhandle, bring Family Care Council back out of the the depths of the mud, so to speak. Because one of the things we do is sometimes we get calls trying to help people find resources in the community. So these calls like this are really wonderful. We try and hold a meeting on the third Thursday of every month from about 11 to 12, and that's Central Time. So I really appreciate everybody showing up. And our next caller is going to be Miss Sassafras. If you remember, if she's ready, and you're muted. So if you want to come on and tell us what you're doing.
Hello.
Hi.
Hello, everyone. I'm just going to take just a second, if that's okay. And I was going to add some resources
Please do.
that we have. And I do apologize for this. I have a doctor's office in Jacksonville, a doctor's appointment rather in Jacksonville today. So I am stopped at a rest stop in my car, but I still wanted to share with you some of our resources.
That's
So,
dedication.
Thank you. Well, it's important to get the word out. So I'm with the Family Network on Disabilities, and we are the statewide parent training and information center for the state of Florida.
Mhm.
And so we are a group of, first and foremost, we're parents that have kids with disabilities, and we're professionally suited. I have been a former advocate. I've been an ESC teacher. I've taught people with disabilities from every range, all the way up to adults with disabilities in the, adult and Medicaid core system. So what we do is we provide information, resources, support, some of which I'm going to add to the chat right now, just so you can kind of get some ideas of what it is that we do. We help parents at any point in their process with IDEA, the Individuals with Disabilities Education Act. And so that is a federal act. It's the nation's special education law. It runs 0 to 22. So we help individuals from 0 to 26 because we want to help them as they're being identified with early intervention, with early steps from 0 to 3 with that individualized family support plan. And then we want to catch them as they're going into the pre-kindergarten program for disabilities, or if they're not allowed into that, help them with the resources to be able to continue the therapies and the early intervention going. And so we do not charge anything for our services. We operate off of a federal grant. We are, oh, did it work?
You're good. Go ahead.
I'm trying to get the pictures to come up and it's not wanting to do it for me.
Oh,
I might do that after I'm done speaking, if that's okay. But so what we do is we help parents with anything. So if you're having some issues with your IEP, first and foremost, if you do not understand it, we are here to help you understand it. A lot of parents don't understand the gravity of the IEP. It is a, legally binding contract between you and the school system. So if you do not understand what you're signing, if you don't understand how the sections relate, then please give us a call and we'd be happy to walk you through that. We can do individualized trainings, we can do group trainings, we do support groups. And, if you're running into a problem and you don't know what to do, there's a dispute with your IFSP or with your IEP, then we can call you, then you can call us and we can give you the information that you need. We're not direct advocates. We don't give medical or legal advice, but we're going to give you all of the information as current as it is and vetted directly from the sources and make sure that you understand how to use that. We understand that a lot of parents know that their kids have a disability. You have to have one of the 13 qualifiers to enter the ESD program. But beyond that, we find that a lot of parents don't understand. So we really want you to understand the different parts and how important the flow of that document is. For example, the first portion, the present levels of educational and functional performance, everything about your child needs to be on there. If it's not on there, that means that your child with that disability does not have that particular manifestation. So if your kid's not talking and you don't have any communication goals, if your child's having fine motor skills, they're not zipping, buttoning, but there's no mention of that on the IEP. There's reasons because, we can have 5 kids with the same disability and they're all going to not have the same needs. Some of them won't have fine motor skills. Some of them will communicate just fine. Some of them will need other support. But unless it's on there, nobody knows and it doesn't have to be served. So we really want you understanding all of the different parts and knowing that if you get stuck, you are not alone. You can call us. We're parents and we are happy to guide you through that process.
that's wonderful. Now, FND has been doing this for over 30 years. I'm sure they've hit,
Yes.
right? One of the best
Started
things
in 1985.
one of the best things I love about FND is their website. It's a huge,
Yes.
huge resource for everyone. And I know the age group for the grants is basically birth to 26. Is that right? Give or take. But a lot of the resources on that website work for people with disabilities of any age.
Yes.
For our nonverbal folks, do you still have the the picture diagram?
Yes, we have access to picture exchange communication cards. We have sound banks. So if you are dealing with an individual and certain sounds are scary and you want to kind of like slowly immerse them at different volumes and get them prepared for big events like, maybe fireworks are an issue or fire alarms in school, whatever that may be. We have social stories where, so if you're going to do something new with your child and you're kind of worried about how they're going to respond, we have examples and ones that are already made of, it's talking about, what you're going to do, what is the process, what are the expectations, what could happen, what's going to be there. And you can use our examples or you can use that or you can call us and we'll help you make your own with your own pictures, even of perhaps the place, your family. But we have tons of downloadable ESD resources, tip books for families. We make them really colorful
teachers.
And bright, easy to understand. Yes, for teachers as well. And like I said, I'll put some of those in the chat so you can kind of get an example. But we have those and we have webinars on like any topic that's related to ESD, including some community resources like how to get on SSI, how to use APD. I made several APD s'mores. It's a clickable flyer that I'm happy to disseminate with anybody because I made them in Haitian Creole, Spanish, and English. And you just click on little tabs. And then one is the actual application. You click and it goes right to the spot. Another one is the list of services. The other one is the navigator, so you have all of that and it's really easy peasy regardless of your native language. So
yeah, thank you for mentioning that. I love the multi-language aspect to the website also. Can you give us
Yes.
an idea of what the STAR program is real quick? I know that's um
The Family Star, yes,
mhm,
that is our sister program. So the Family Network on Disabilities, we're broken up into 3 geographic programs that all are the Parent Training and Information Center, but we have a statewide sister program, the Family Star, and that's an acronym for what we all do. It's support, training, assistance, and resources. And so instead of your disability, this is going to be kind of a crossover between chronic mental health problems,
mhm,
chronic physical health problems. So say your child has, whether they have a 504 or a IEP or not, but they have an emotional or behavioral disability,
mhm,
if there's concern about Baker acting, about restraint, about, having them separated from the class and being put in, with the least restrictive environment with the principal, any of that kind of stuff. Additionally, if you fall under that OHI and the IEP, that other health impairment,
mhm.
and even if you don't have a 504 or have an IEP, maybe you need one because, maybe your child is in and out of school due to hospitalizations, or they can't get their therapies they need with a professional that's not during the school day, and it's starting to impact into attendance and starting to have some issues. Whether it's medication administration, whatever, we can help you with that as well through the Family Star. So again, it's that, support and training and assistance and resources, and talking to parents who have been there and understand
Right.
how frustrating it is, and can help guide you to a better spot.
Yeah, that's what's neat about Family Network is that the parents get it, we get it, and go from there.
Yeah.
All right. Thank you so much for coming to us live from the rest area. Are you almost to Jacksonville, or whereabouts are you?
Oh gosh, I think I'm right outside of Live Oak.
Okay.
So ish. And I'm based in Tallahassee, guys, but I have 14 counties across the Panhandle. So I certainly cover area 1, but all the way over to the Madison, Jefferson, Taylor line. So,
Gotcha.
and then again, anywhere in the state, you are covered by FND. So all of our services are free. Just let us know.
Wonderful. Thank you so much.
Thank you.
Miss Annette, do you have anything you would like to add? We tried to include Mr. Dwayne on, but he wants Miss Annette or Miss Linda to talk about VR with APD. Just one of you two ladies would like to take that?
I will let Annette talk about VR.
Okay, Miss Annette, you're up.
Did
Put
we
you on
get
the
anyone?
spot.
Did we get anyone from vocational rehab to join us?
Mr. Dwayne is on the line, but he
Well,
wants.
no, he's not with vocational rehab.
Okay, gotcha.
I was just trying to see if we had, because I'm not with vocational rehab, with the Agency for Persons with Disabilities.
Gotcha. Could you explain to us? Uh, there's a big push in Florida right now to get people with disabilities employment. So if we'll just use Ben for example. If Ben is fixing to graduate from school and he's looking at VR services, how does the VR pick that up, and then how does that plug into APD?
Well, you would do a referral to the Division of Vocational Rehab,
Mm-hmm.
and they would do all the pre-employment, and any employment training that he would need. They have a variety of services that support employment, get him ready for employment. They would assign him a job coach who
Right.
would develop an employment opportunity for him. VR will, until he's employed and stabilized at that job, that he will continue with VR funding. The Agency for Persons with Disability picks up when he's stabilized, and we provide the ongoing supports to maintain that employment.
Gotcha. So when we talk about pre-employment, what does that include? Do you know?
It's all the soft skills. Normally they can start at age 14, And we're trying real hard to get all of our students connected to vocational rehab at age 14. They
Mhm.
have a variety of camps. The Center for Independent Living has a camp. They do pre-employment training also. So Carolyn can definitely provide that information.
Great.
Um,
So soft
but it's all
skills,
the
that
soft skills that you need for a job.
so that would be like maybe defining what a job might be, looking for the right fit. Maybe it's,
How
I
to,
remember early on
how to
someone wanted to be a
interview and how to interview and how to find a job and how to present yourself.
gotcha. And y'all are doing something tomorrow at Marcus Point with that, aren't you?
Yeah,
Or is that
tomorrow at Marcus Point, we are doing mock interviews with employers.
Mhm.
Um,
Real
we're
employers?
yeah, real employers. We're going to give each student, the Escambia County Schools is transporting the students to Marcus Point, and we will have 20 employers there, offer each student 3 interviews.
Mhm.
Now, we have had individuals hired if the employer recognizes certain skills and they have a vacancy. We've had students hired through this process, but basically, it's just to give them an opportunity to see what it's like to be interviewed. The interviews are
Right.
very short. The teachers have prepared them for the interviews. They have the questions. Some students will come all dressed up and ready to go.
Mhm.
Um, and it's early in the year. Some will be nervous. We do it in October and we do it in March.
Right.
And we see a big difference from October to March. So,
Mhm.
tomorrow, we're also bringing the career camps that students can sign up for at age 14,
Okay.
that vocational rehab funds. We've got 4 camps that are going to be there, and they're going to do activities with the students and share the information that about their camps and how to sign up. And we're also going to have Goodwill there to share information on all the trainings that they offer for free, computer skills training and all kinds of skills that they offer at Goodwill.
I see.
Wonderful.
I
Okay,
have a
we've
quick
got,
question.
yes, ma'am.
Does, do you have to be a student from Escambia High School or Escambia School District or an APD client in order to be able to go to that thing at Marcus Point?
No, no, If you
And what
can,
time?
if you can bring your individual there, we'll give them an opportunity. I mean, we will share any information we have. It's just the schools are transporting the Escambia students there. In the past, we've had Santa Rosa and Okaloosa participate, but it is a very big challenge to transport students to one site.
Yes.
Even Escambia is having a challenge to get the ones from the north end down to Marcus Point. So
And what time is that going to be tomorrow?
we're going to start at 8 and it'll be 8 to noon.
Okay, thanks.
So since we don't have you on the list, but we can get you on, we can get you and we can get your individual interviews and they can get information about the career camps.
Okay, it's actually the grandson of a friend of mine, and he just graduated this past year, and he's really not connected to anybody right now. So
Wow. Okay. But vocational rehab would be a good connection to make if you need that information on how to do a referral. Is he located in Escambia County or where is he located?
yes,
Okay. We can get you that information. I can give it to Jim and he can share it with you. The application on how to apply. How old is he?
he's 19. I think he's
Oh,
19.
he needs to be connected. Is he
Yeah.
still in school?
No, he graduated, but
Okay.
his IEP was just put in at the last minute, so he didn't get any of that transitional service
Wow.
from
Wow. Okay.
so and his what he'd really like to do is to run away with a girl and get rich. So
Yes.
But
Yes,
at any
ma'am.
rate, well, I'll pass this information on to his parents and see
The
what they
only
can do
thing
for him.
we may not have a lunch for him. I don't want to get him disappointed because we do have lunch for all the students, but those were all pre-ordered.
Okay.
So I don't want him to be left out.
All right. Well, thank
It's
you.
it's really quite the activity the to see Marcus Point transform into for the students, and it's a well worked out situation for everyone, and it's a great resource for kids just like him. Graduated high school, not sure what to do next, and where to go from there. So it's really great hands-on stuff. Um, Annette, is Noah going to be speaking?
Yes, Noah's going to be presenting. He's an individual with autism and he's going to do 3 sessions. And
Mhm.
he's all excited about talking to students and his story and how he developed his business and the
Mhm.
challenges he's overcome. So,
Him, Noah is a person with disability, but one of his great loves was being a photographer. And they live in Navarra, so he's actually developed a business where they do family photographs in a very relaxed type of setting. And he's quite the go-getter. He's really interesting. So I'm really glad to hear that he's presenting. I'd love to be there to see what's going on, but I've got other obligations here in Milton. Um, Miss Linda, thank you, Annette, for all that wonderful stuff. Miss Linda, do you have anything else you'd like to add for resources?
Um, Not really. I wanted to thank Ms. Middleman for the information that she shared about the resources that she has and that she can provide about APD, um, as well as individuals can also go to our website, apdcares, CARES.org, to review our website, and it has a lot of information, all the way from eligibility to the services on the Medicaid waiver, as well as resource links as we network with other agencies to provide the services that individuals with unique abilities need in
Yeah.
order to live successfully in their communities.
And wasn't there a navigator program connected with that website? Am I calling it the right thing?
Um, Jim, I'm not sure if that is listed on the website at this time.
Mhm.
It may be. I'm not real sure.
I was thinking about the tab where someone could go on and say, I'm looking for resources for a person with disabilities in this area, and I need, a variety of different things they can check, and then they would get a list of resources that's listed. I might not be calling it the right thing. Navigator may be the wrong name for it. That's what I'm trying to.
Okay, there is a link, community resource directory,
Okay.
and you can go on there. And you can select different categories that you would like information about, and then it will lead you to those resources in the community where the individual lives.
Wonderful. Okay. Is there anybody else that's online that has questions or would like to talk about an organization? I think my mouse decided to quit working.
Actually, if you don't mind, then I would like to share a little bit about our problem so
Okay.
that maybe agencies can think about it for the future. Um, we are guardians of a young man who is now 41 years old. He's on the autism spectrum. He has very little functional communication, and believe me, we've tried everything from high tech to low tech over the years. Um, he has some medical needs, which means that he will not be accepted at any of the group homes in the Pensacola area. He requires ICF level of care. And our concern is that all the ICFs are, they look like nursing homes, and we'd really rather have him be in a more homey situation. And that's what we're running up against. We did visit Pensacola Developmental Center and um, New Horizons, I think is what, or Horizons.
Mhm.
We visited those two, and the people were very nice, and there were people that worked there for a long time, which to me says that they must be decent organizations. But it's, you know, it they look like hospitals or nursing homes, and we would like something a little bit homier and smaller for John. Um, and we're just not sure how we can get that. I mean, we could probably make the funding work with his CDC plus money,
Mhm.
but there's not money in there for somebody to administer the program. And for us, you know, the whole purpose of getting him into someplace stable right now is because we're aging. You know,
Right.
I'm 74, I'm 73, Nancy's 70, no, I'm 74 and Nancy's 73. And we would like to get him someplace stable so he doesn't have to transition during a crisis if something happens to one of us.
Gotcha.
We're just, we're not finding real homey services that can meet his medical needs, basically.
Linda, is there a way that she can get a hold of the group director, for lack of a better word, to help maybe to see if there's a homier type listing in the Panhandle?
Yes. So Ms. Brown, you do have a waiver support coordinator, correct?
Yes.
Okay. So the waiver support coordinator would submit a residential referral request.
It's
And,
been done.
okay, and if you would like to expand the search beyond Escambia County over to, I know that in Tallahassee, there are some smaller ICFs that have recently opened up. They are in high demand, but they are located in Leon County. Now, beyond the Northwest region, we could also expand the search to our neighbors in the Northeast. You know, we could look at Live Oak, Gainesville. We can look anywhere in the state of Florida. I know that distance might be a factor, but there are some other options, but not in Escambia County at this time.
Wonderful. Yeah, I know it's a long process, so I really appreciate that. And sometimes it's difficult to find, homes like that. I know they're out there because I've done home visits in the past, or group home visits in the past. Um, but the distance, Ms. Deb, I'll reach out to you afterwards, and we'll see what we can do to help you with anything else in that direction.
Okay, thanks.
Due to our time limits here, we're closing in on the hour. We've had a lot of information on this pack. Does anybody else have any questions or want to talk? May have forgotten something about the agency they want to list. Okay. Well, at this time, once again, we're going to try and do Family Care Council meeting via Zoom link, the third Thursday of every month, and we'll be sending out the links to that later this afternoon. Once this video processes, then we'll be sending out links to it to all of those who registered. I want to thank our agencies for coming today and presenting just something about there. I hope that we've helped somebody linked into some of the great resources that are out there and maybe not known about. But Miss Denise has her hand up. Go ahead.
As a guardian advocate for my brother, who's a CDC consumer, this is kind of a random question, but it's the latest challenge I've been up against the last couple weeks. I've been buying his pull-ups and associated supplies out of pocket for the past 3 years. And I learned that I can have them paid for through his CDC funds. But one of his caregivers has a child who's special needs, and she cares for part-time for a couple of older individuals who receive APD services. And their insurance, they're on Medicaid, and my brother's on Medicaid. They receive it free of charge. They receive the pull-ups and all the supplies. I have been calling and talking to everybody, and nobody seems to know what I'm talking about. Does anyone else
answer that question?
So that's for us. That's
My
the answer
daughter
for
is on CDC Plus. Yeah, my daughter is on CDC Plus, and I was her representative for 10 years. So what you're going to need to do is talk to your support coordinator and whoever the representative is, and you're going to have to sit down and do a quick update, and you're going to have to add that into your purchasing plan that you want to cover these disposable medical supplies, and they are absolutely covered. So you just need to set that up with your support coordinator and the representative, and then you do your quick update, and then it can go into effect for the following month.
Right. I may not have explained myself adequately. I'm his representative, and he does have, I have talked to the waiver support coordinator, and I know that I can do a quick update and get it through the purchasing plan. But this person has told me that it does not have to be paid for, that he can get these things free of charge because he's on Medicaid. And I have called people that she's told me she gets hers from. One company says they no longer provide incontinence supplies under Florida Medicaid. And I was just wondering if anybody else has heard anything about this and a way to get this. Because obviously, if he's able to get these supplies free of charge, I would prefer not to use his funds.
Well, if he was on the big waiver, like on the regular, home and community-based waiver, that absolutely does. So I don't know about the interrelation between, just the straight state plan Medicaid or the HMO that he's on, because, just straight Medicaid, that divides out into different programs. And so you're looking at what those individual carriers provide and whatnot. But since you are on CDC Plus, that is a backup option for you.
Right. As a matter of fact, we were going to do the order through a purchase plan. And then once I heard from my brother, one of his caregivers, that we could get them free of charge, I've been trying to pursue that, but I can't seem to. And I'm almost at the point, like I have been with a lot of CDC stuff, you finally throw your hands up and then just pay out of pocket or do whatever because you run into so many brick walls, But anyway, that's my issue.
Ms. Gunn?
Yes.
And I'm pretty sure the answer to this is yes, but is your waiver support coordinator that you're working with aware of what you've been trying to do and the barriers?
Oh, yes. And as a matter of fact, she's never heard about this option to get these free of charge through insurance. And I called my brother's insurance, UHC, and his navigator there actually called our waiver support coordinator, and they talked. Neither one of them have heard of it either. But this caregiver, like I said, she said one of her clients is an 80-something-year-old lady, and she receives hers free of charge. And the caregiver that I'm speaking of has a son who is under APD, and he receives them, but he's a minor. He's 19. So I know that can make a difference. But she said that these older clients, 2 of them, also receive it through the Medicaid.
This is Carolyn from the CIL, and I'm wondering if the persons who are the older recipients are on the Medicaid waiver through Area Agency on Aging, depending on what their level of care need is, they may be on a different health plan also. That may be why they were able to get it as well. I mean,
And- Right. That does make sense. I just wish I could get an answer. You know, it gets very frustrating trying to
Right.
navigate
So-
all this and just not being able to get a clear answer.
And Annette may be able to answer this, but I believe that you can't be on both APD and on that waiver program. So you can be on one program or the other. And often if you're on APD, your other services that you would be getting would be greater for your general programming services might be greater there than what your medical additional services that you might get would be. Like you have to weigh out which program serve it. You can't have both, I guess is what I'm saying. So you have
Right.
to get which services for which program you need more and you get more of, but then you don't get the other program services. I guess it's definitely a lot to weigh and look at. But you have to look at which ones are where for which things. And then also, like as an example, we're coming up on the Medicare enrollment period.
Mhm.
So which healthcare plans will people sign up for if you are an adult? Or if you're the guardian signing the adult up for the program. And sometimes different health plans will cover different services for what an individual may need will be different as well. So there's a lot of variables to be considering.
Right. And I've tried to sort of figure that out as well. Because I thought, well, maybe since he can get it because he's on a home and community-based waiver, that's his funds, through CDC. I thought maybe he can't get it because of that. But I can't even find anybody who even knows anything definitive about how this works. And I just wanted to know something. I just need to know something solid.
HMO or who is PIP through Medicaid is. Years ago, Medicaid used to just be straight plan Medicaid. And now it has been, it depends on where you are, what the different options are. So you need to figure out what his HMO or PPO under his Medicaid plan is and talk to them about what services his plan provides. Because it's not just a straight Medicaid issue. You're looking at those individual providers and what they provide. Other than that, what Carolyn was saying is absolutely right, is maybe weighing, do you have the big community waiver versus CDC Plus? On CDC Plus, you have to itemize everything. There's not just gimmies like you would get if you're like if the HMO or the PPO did not provide them, those would be provided through the main waiver, but that's not an option on CDC Plus. So really the answer is to figure out what his Medicaid provider is and then what that they allow to purchase as far as consumable medical goods, if that makes sense.
What do you mean about his Medicaid provider? Who would that be? Who's the point of contact?
Okay, so that he should have some sort of a card, and if he doesn't, what you can do is just look at his gold card, which is just the Medicaid card, and call that number and say, hey, I am the guardian / representative for CDC Plus. I need to know, because he doesn't just have Medicaid, he has Medicaid Humana, Medicaid Blue Cross Blue Shield, Medicaid, Liberty for dental services. My daughter actually got grandfathered into state plan Medicaid, but it was a price. Generally, you're on a secondary insurance provider. It was all outsourced many years ago.
She said he's on United Health.
United Healthcare.
So you need to talk to United Healthcare because they're your actual provider. Medicaid just this contract is through them. So you need to talk to them and find out what they cover as far as, the medical supplies, consumable medical supplies. And
I
if they
did.
don't cover it, then you're going to have to go through CDC Plus.
Right. I did call United Healthcare and spoke with his navigator, who was very helpful. And she told me I needed to contact his waiver support coordinator. And that's when I gave her the number and they talked over the phone. And neither had ever heard of what I was referencing. That's just the frustration. It's just constant going through this and trying to sort through it and figuring out how to deal with it. I would like to recommend, though, I appreciate all of y'all's suggestions and guidance on this, and I'm going to see what I can find out from here on out. But Jim, I would like to suggest a discussion about how to deal with insurance, Medicaid, Medicare, dental, health. I mean, I get so overwhelmed and it changes all the time. And I'm not even sure I just became my brother's full-time care person a little over 2 years ago when my mom passed. And it's just really been overwhelming in so many ways. But, you know, with them talking about insurance and who to talk to and how things are done, I'm relatively intelligent and can understand things, but the insurance thing is just kind of mind-blowing at times.
Gotcha. What I'm going to do is I'll email you my cell phone number so that we can chat some more. I think I have an insight into the different programs that they were just discussing, like the long-term care program. But we're almost out of time. Linda, I seen you came back online. Did you have what?
I put our waiver services supervisor's email address in the chat. It's Natasha Broxton, and Ms. Gunn, you can always reach out to Natasha for some assistance regarding the CDC Plus program. At least she'll be able to maybe give you some additional feedback from the state office on some things. But yeah, Jim, I know you've got a lot of experience with doing that. So
And yeah, also we talked about the Family Star program. Sometimes they can help cut through the red tape on the different insurance questions, and we'll have to bring them online one day for meeting. A lot of the organizations out there, I know we could spend an entire hour on just some of the different things that you all do, because you're out there doing it in every day, and we really appreciate that. But we're right at the end of the hour. We need to say our goodbyes, and so the video can process. Once again, and Denise, like I said, I'll send you a phone number and where we can chat and get you some more specific things. Y'all can reach me either at the Family Care Council on Facebook or at the same email address, the By My Side Today. If you have questions or you need follow-up or if you get stuck with different things. I want to thank everybody for joining us today, and I really appreciate this has probably been one of the best meetings that Family Care Council has had in quite some time. So I'm really glad to see everybody here, and we need you. We need your voices. We need what you're doing out there, and we appreciate it so much. I went.
Just one more quick thing, just to remind everybody to make sure they make their choices. Watch for the meetings that are around town on the insurance, because they will have to make those choices in the coming month. So just watch for the meetings so they can learn that information for themselves. That will be up.
Okay, wonderful. I want to thank everybody for joining us today. And once again, once I get this process to anybody who had registered for the Zoom call, we'll be sending the links out to it. It'll be posted to YouTube from there. Once again, we're going to be holding meetings on the third Thursday of every month from 11 to 12, and it'll be done via Zoom at this time. And once again, thank you all for what you do. And we're going to chop it off from here. Thank you so much.
Thank
Bye-bye.
you.
Thank you.
Bye.